What are the top 5 reasons for hair loss? Number 1, age. Almost everyone will notice hair loss and hair thinning as they age. Our cells continually grow and die off at all ages, but when we're older, our cells die off more quickly than they regenerate. As we age, we also produce less oil in our scalp, which can make our hair weak and brittle. This can also contribute to an overall hair loss and thinning. The second reason is genetics. The most common type of hair loss is hereditary and related to age. It's commonly referred to as male or female pattern hair loss, and it affects more than 50 million men and 30 million women in the United States. This is a more extreme form of hair loss that usually begins in young adulthood and gradually progresses with age. For males, this type of hair loss often starts at the temples and expands to the top of the scalp. There may also be a little thinning at the top of the head. For females, it usually first becomes noticeable where you divide your hair, but there's gradual thinning all over. The hairline typically stays the same, but the hair part can widen. The third reason is hormonal changes. People with conditions like polycystic ovarian syndrome and congenital adrenal hyperplasia can have higher androgen levels, which can cause female pattern hair loss. If you are a woman who experiences more obvious hair loss and any of the following symptoms, you may want to ask your healthcare provider about having your hormone levels tested. Acne, excess hair growth on the face or body, irregular periods, other things that can cause dramatic changes in your hormone levels like pregnancy, childbirth, menopause, and hypothyroidism. These too may also affect your hair growth. Even changing medication routines can cause your hair to become thinner if your medications affect your hormone levels. For example, some women who stop taking birth control pills can experience hair loss. Fortunately, in most of these cases, you can slow down or reverse the hair loss with proper treatment. Yes, stress is another reason. Out of nowhere, you notice a lot of hair falling out. You see it on your pillow, on the floor, on your clothes, and stuck in the shower drain. Hair seems to come out so easily, you're actually afraid to brush it. Now, the medical term for this is telogen effluvium. During a telogen effluvium, it might feel like you're going to go bald, but rest assured, you won't. Telogen effluvium is a response to stress. Excess hair shedding starts 2 to 3 months after a stressful physical or emotional event and peaks about 4 to 5 months later. Over time, your body readjusts and the hair gradually stops falling out. Within 6 to 9 months, things go back to normal. Stressful life events like losing a loved one, going through surgery, or being diagnosed with a serious illness can all increase your risk for hair loss. But hair loss itself can be stressful too, which can lead to a vicious cycle. Remember though, telogen effluvium is temporary. You will not go bald from it, and your hair will come back. In most cases, no treatment is necessary. Nutritional deficiencies can cause hair loss. A chronic form of telogen effluvium can occur. This type of hair shedding starts slower and lasts longer, over 6 months. Possible causes are often related to nutritional deficiencies. Having low levels of iron, vitamin D, and zinc have all been shown to be linked to hair loss. Vitamin deficiencies are usually easily corrected with dietary supplements. It's important to always talk to your provider before you try any new supplements. Do any of these affect you? Thanks for watching our hair care education.